Hello and welcome back, everyone. My name is Trung Tran, and I'm Alice with the LEA Provider Relation Units. We will now get started with our afternoon sections. As a reminder, to use the chat, click the chat icon on your toolbar, as shown in the graphic here on the right. A chat window will open on the right side where you can type and submit your questions. If you have questions during today's meeting, please submit them in the chat. We have a lot of content to cover this afternoon, and the chat will be monitored by DACS to answer your question as they come in. If we are unable to answer your questions, we will either get back to you or add them to our next quarterly meeting. If you have questions or if your question are not addressed during today's meeting, please send them to the LEA inbox at lea@dacs.ca.gov. Additionally, DACS will share important links and further resources in the chat after the section is complete. Live captions are available for anyone who needs them. The graphic on this slide highlights the step to enable live captions with arrows pointing to each option in Teams. To turn on captions, please click the More icon in your Teams toolbar, select Language and Speech, and then choose Show Live Captions. Caption will appear in the bottom panel of the meeting. A live transcript is also available for those who may need it. The graphic on the slide highlights the step to enable live transcriptions with arrows pointing to each option in Teams. To turn on the transcript, click the More icon in your Teams toolbar, select Record and Transcribe, and then choose Show Transcripts. The transcript will appear in the right side panel of the meeting. Lastly, please feel free to have your camera on or off during the meeting, whichever you prefer. On this slide, there is a graphic of what the listserv webpage looks like on the right side of the screen, where you can fill in your name and email address and then hit the subscribe button. DACS communicate to the LEA Bob listserv regarding important programs information. This is the portal through which you will receive all communication regarding meetings, program policy updates, and reminders. Please sign up if you haven't already. You may subscribe and unsubscribe to the listserv using the descriptions link found on this slide. Please do not email the LEA inbox to sign up for the listserv or request to sign up for another employee. We cannot subscribe or unsubscribe for you. Instead, use the link on the LEA Bob homepage to sign up. Also, to ensure slides are available before each section, reminders are sent 2 to 3 days in advance and again on the day of the meeting. Slides are distributed through the LEA Bob listserv, making subscription essentials for timely access to materials. Just a quick reminder, slides were sent out the listserv this morning. If you're not already subscribed, you can join the LEA Bob listserv to get future e-blasts with the link below. Also, we drop a Google link in the meeting chat with the slides. If you're having trouble accessing the link, please provide your email address in the chat so that DACS can provide you with the slides. Today's introduction and goals, we will be talking to the Random Moment Time Study foundations and key changes coming with the new Centers for Medicare and Medicaid Services guidance to prepare LEAs and program partners for the Time Study Implementation Plan effective July 1st, 2026. Before we move forward, we want to share an important disclaimer. The information presented today reflects proposed changes coming with the proposed TSIP and is subject to change pending CMS approval. We are sharing the information now because the CMS guide on implementation of the school-based Medi-Cal program requires implementation by July 1st, 2026. We believe that if we wait until we have CMS approval, there will not be very much time to prepare. What we are talking about is what is in this published CMS guidance. Please note that DACS remain committed to ongoing communication and technical assistance for LEAs and program partners. We will keep you informed as updates occur. As we move forward, DACS remain committed to full alignment with CMS approved standards. Any contents not aligned with the approved TSIP will be removed. If proposed policy change or rejected by CMS, this content will be updated after TSIP approval, and future training will reflect the revised policies and modifications. Our priority is to keep all material accurate, compliant, and current. Here's our agenda for today's meeting. In Section 1, we will begin with reviewing the impact of the 2023 Centers for Medicare and Medicaid Services guidance on the Random Moment Time Study. Next up is Section 2, where we will review Random Moment Time Study foundations. We will then move on to Section 3, which covers key changes introduced with the proposed Time Study Implementation Plan. These are the big updates you need to know, so let's dive in. The goals of today's meeting are to reinforce understanding of the RMTS and how it is impacted by the new Centers for Medicare and Medicaid Service guidance, provide a clear overview of proposed policy changes that are effective July 1st, 2026, share strategies for building TSP lists, preparing for Quarter 1, and maintaining audit-ready documentations. Finally, to recognize the necessary collaboration with your RMTS administrative units and the Department of Healthcare Services. Please note that we will now refer to the Local Educational Consortium, or LEC, as the RMTS administrative units, or RMTS units for short, in alignment with the Time Study Implementation Plan. While many region RMTS administration is provided by a LEC, not every LEC independently administers by the RMTS, and some LECs operate jointly or share responsibilities. Here is a list of commonly used terms and acronyms that we'll be referencing throughout the sections, including CMS, which stands for Centers for Medicare and Medicaid Services, and CRCS, also referred to as Cost Reports, stands for Cost and Reimbursement Comparison Schedules. Here are more commonly used term and acronym that we'll be using throughout the sections. As a reminder, we will refer to the LEC as RMTS Administrative Units, or RMTS units for short, and the Time Study Implementation Plan will be abbreviated as TSIP. I will now hand it over to Lacey for the first sections.
Thank you, Trong. Hello, everyone. My name is Lacey Allred, and I'm an analyst with the LEA Provider Relations Unit. In this section, we will go over the impact that the 2023 CMS guidance will have on the RMTS moving forward. The RMTS is governed by CMS requirements. New guidance was issued in May of 2023, 20 years since the last published guidance. So these changes are a big deal. CMS sets the standards for how states run RMTS. That means our process has to be statistically valid, applied consistently, and backed by solid documentation. When CMS reviews a state's RMTS plan, they want to see that the time study methodology is uniform and defensible. And yes, CMS and the Office of Inspector General will periodically review state RMTS processes to make sure we're meeting those requirements. We will provide the link to the CMS guidance in the chat at the end of this training if you'd like to dig a little deeper. Let's talk about what CMS expects when it comes to RMTS before going into the main foundations of RMTS. First, moments must reflect what a participant is actually doing at a 1-minute moment in time. It is a 1-minute snapshot, so a time study participant, or TSP, should describe what they were doing right then, not what they plan to do later or what they think they might have done. Responses need to be clear and detailed. The TSP should think, who were you with, what were you doing, and why were you doing it? Avoid acronyms or vague phrases like paperwork, and never include protected health information, PHI, or personally identifying information, PII, in your responses. Other LEAs can see the responses, so there's no expectation of confidentiality. Instead of saying you were helping John Doe complete the Medi-Cal application, state that you are with a parent helping them complete the Medi-Cal application, so their family could be enrolled. Coding has to match federal policy. The more detail given, the easier it is for the RMTS unit or LEC to assign a correct activity code for Medicaid administrative or direct service activities. Documentation matters. Every moment needs backup documentation for audits. Electronic records are fine. Just make sure they're organized and accessible. Specifically for administrative moments, the more robust and detailed the moment response, the better you are documenting your 1-minute moment. All of this is spelled out in the pending Time Study Implementation Plan, or TSIP. The plan ensures everything is consistent and defensible statewide, and it will require CMS approval before implementation. Now we will get into RMTS foundations to prepare LEAs and program partners for the proposed TSIP. Let's start with the basics. RMTS is not a program, it is a methodology. RMTS is a federally approved, statistically valid method for capturing how staff, also known as time study participants or TSPs, spend their time during the workday to determine the amount of time that is spent on Medicaid reimbursable activities each quarter. RMTS is web-based and randomized. Each RMTS quarter, participants are randomly selected to receive a moment at a random time, where they are asked what they were doing at that exact moment. A moment is a duration of 1 minute, and participants currently have 4 student attendance days to respond. Not all participants will receive an RMTS moment. Based on a time study participant's response, these moments are then coded as a reimbursable or non-reimbursable activity. This data is essential for cost allocation in both the LEA BOP and the ESMA program, helping ensure Medicaid reimbursement. RMTS is a component of the payment methodology for the two school-based Medicaid programs, LEA BOP and ESMA. Again, it is not a standalone program. This graphic illustrates the RMTS administration oversight at the various levels, starting with the box at the top, representing that CMS is the federal oversight agency. It then drops down to the DHCS logo, indicating that DHCS is the state oversight agency. Under the DHCS box, it splits into the two separate programs, which are the ESMA program and the LEA BOP. Under the ESMA program, the RMTS unit is shown first, and then the LEA is under the RMTS unit, illustrating the levels of oversight. For LEA BOP, the LEA is shown under the LEA BOP with a dotted line to the RMTS unit to illustrate that although the LEA is not under the RMTS unit with the LEA BOP, the LEA still works with the RMTS unit to administer the RMTS for the program. As a reminder, CMS is the federal agency that oversees programs including Medicare, Medicaid, and the Children's Health Insurance Program, or CHIP, as well as the health insurance marketplaces. CMS approves the covered services, practitioners, and reimbursement methodology, among other items, for all Medicaid funding, including the LEA BOP and the ESMA program. DHCS is the single state Medicaid agency that administers the ESMA program and LEA BOP in California to help schools receive federal reimbursement for health-related services and administrative support provided to Medicaid-enrolled students. ESMA reimburses schools for administrative activities that support the Medicaid program, such as outreach, facilitating the Medi-Cal application, and coordinating medical services. The LEA BOP reimburses schools for direct medical services provided to students, like physical therapy, speech therapy, and nursing services, just to name a few. Because the programs reimburse the actual cost of providing services, both programs use the RMTS methodology to capture the time spent on these activities and services. RMTS for both ESMA and LEA BOP is administered by the RMTS units. LEAs that participate in one or both school-based Medicaid programs need to contract with their regional RMTS unit to participate in the RMTS. The RMTS administration by RMTS units is represented by the dotted lines on the slide. On this slide, you will see a graphic at the bottom that demonstrates how RMTS impacts your LEA. From left to right, participants are shown by a group icon. Response to a moment, which then feeds into the DMSP for LEA BOP and RMTS percentage for ESMA, which shown by a money icon are a key component of the reimbursement calculation for both programs. It is key to know how RMTS financially impacts your LEA. As was mentioned earlier, both of the school-based Medicaid programs, ESMA and LEA BOP, reimburse LEAs for the cost of providing services to Medi-Cal enrolled students. This is done by determining the amount of time spent on services that Medicaid will reimburse and then reduce it to the percentage of students enrolled in Medi-Cal. RMTS results are used to identify, measure, and allocate the proportion of time that LEA staff spend on allowable Medicaid administrative and direct medical service activities. These results are then applied to actual salary and benefit costs to calculate the federal share of reimbursement. The RMTS results as an RMTS percentage in ESMA or the direct medical services percentages or DMSP in LEA BOP are one of the key components in the payment methodology for determining federal reimbursement for both programs. The bottom corner of this slide shows a checklist icon alongside a group icon with a question mark. These graphics are to illustrate the Time Study Participant or TSP list. Now let's discuss the TSP list that is required from LEAs when participating in RMTS. The TSP list includes all eligible staff employed by the LEA that are expected to deliver covered services to students in the upcoming quarter and whose costs will be claimed through one of the two programs. California uses two participant pools. Pool 1 for LEA BOP consists of direct medical service staff who perform direct services and must meet the practitioner qualifications necessary for reimbursement through the LEA BOP. Pool 2 for ESMA is comprised of administrative activity claiming staff who conduct allowable Medicaid administrative activities on a regular basis. This pool also includes direct service practitioners who perform administrative functions and will not be claiming any direct medical services during the quarter. An example would be a supervising clinician who does not provide direct services. Please note a TSP cannot be listed in both pools. This slide contains two icons near the center divided by a vertical line. One is a checkmark icon to represent participant pool 1 on the left, and the other is a handshake icon to represent participant pool 2 on the right. So who should be on your TSP list and who shouldn't? Let's break it down. State or non-federally funded staff belong on the list if your LEA plans to claim their costs through the LEA BOP or ESMA. If someone is 100% federally funded, they're out. They cannot be on either list. Pool 1 is for direct medical service staff. Only employed practitioners go on Pool 1 list if your LEA has both employed and contracted non-federally funded staff. Pool 2 is for employed staff or contractors who perform Medicaid administrative services for LEAs that only participate in ESMA. LEAs who are only enrolled in LEA BOP, not ESMA, are Model 2 LEAs, meaning all of your practitioners are contracted and do not need to participate in RMTS. One last tip. Staff changes happen often, so work closely with your RMTS unit to submit, review, and certify your TSP list every quarter. Keeping it accurate is key to compliance and reimbursement. This slide has a flowchart made of icons to show a simplified overview of how the TSP list impacts the LEA BOP and ESMA. The TSP list is used to identify the universe of personnel that may receive a moment during the quarter. Please note there are more details in the process, but generally this is how it works. At the top of the graphic, the TSP list identifies all staff eligible in participant pools 1 and 2 to participate in the RMTS. On the left side is a group icon for Pool 1 participants for LEA BOP, and on the right side is a group icon for Pool 2 participants for ESMA. As indicated by arrows, both group icons meet in the middle to participate in RMTS, where all TSPs on the TSP list are eligible to receive a notification to respond to a random moment. Based on moment responses, a calculation is then made to create the DMSP for LEA BOP and the RMTS percentage for ESMA. This is shown on the graphic by arrows moving down to each calculation from the RMTS icon. The icons for these calculations is a clock with a pie chart. And finally, the DMSP is included in the CRCS for LEA BOP, and the RMTS percentage is included in the ESMA invoice, both represented here by an icon of a clipboard with an envelope. It's important to be aware that every TSP included on the TSP list impacts the RMTS percentage and DMSP through their responses to random moments. Without a TSP list, you cannot calculate the time your eligible employed staff spent on covered services, which is the purpose of the RMTS. It is also very important to remember that all TSPs must be on the quarterly TSP list that corresponds with the costs for that quarter on the LEA BOP, CRCS, and ESMA invoice. And with that, I will hand it over to Mohammed to discuss the importance of an accurate TSP list.
Thank you, Lacey. Good afternoon, everybody. My name is Mohammed Fazal, and I'm an analyst with the ESMA program. So the graphic on the right of this slide illustrates an individual identifying who to include in their TSP list. Now that we've discussed the impact of the TSP list for both programs, let's discuss why an accurate TSP list is important. For the LEA BOP, LEAs can only include employed practitioner costs on the CRCS if those practitioners are on the Pool 1 TSP list. If practitioners are not on the LEA's cost report, the LEA isn't getting any reimbursement for those practitioners. As a reminder, the CRCS is one of the most important compliance documents for LEA BOP and is where your LEA certifies the cost of providing covered services to students. This determines what an LEA receives in the final settlement. And for ESMA, costs can only be claimed for eligible staff that were included in the Pool 2 TSPs list. Per the current ESMA manual in section 6-10, claiming units can only claim costs for TSPs that were included in the approved universe of TSPs. LEAs wanting to claim costs for their eligible employed staff must ensure they include staff who will be providing program-covered services during the quarter to their TSP pool lists. The graphic on this slide demonstrates an example to explain the importance of building quality TSP lists. Two group icons, each representing an LEA's group of TSPs in the same region, have a calculation of their moment responses that were coded as eligible. An arrow then points towards an icon with a clock and pie chart to represent the RMTS moment result calculations pulled together for the region. We will be explaining the details of this graphic further below. Remember, everyone on your TSP list may receive random moments asking what type of activity they were doing at that moment. Those moments are coded as either allowable or unallowable under both programs, so it does matter whether your TSPs are actually providing eligible services during the quarter. We'll illustrate how this works. So let's say you have two LEAs in the same region. Each LEA receives 10 random moments for their group of TSPs to respond to. LEA 1 spends a lot of time providing program-covered services, so 7 out of 10 moments are coded as eligible. LEA 2 does spend time providing program-covered services, but not as much. So only 2 out of 10 moments are coded as eligible. The moment results are then pulled together, so the RMTS results calculation for the region would be 45%. So if an LEA is increasing the number of eligible staff on their TSP list, but most of these staff's time is not being spent on program-covered services, then many of their moment responses will be coded as non-reimbursable. This will then dilute the entire region's RMTS results calculation and lower the percentage of cost your LEA can claim. In general, for both the LEA BOP and ESMA programs, there's a consideration LEA should make regarding adding all eligible Pool 1 and Pool 2 staff to the TSP list for a quarter, compared to only adding staff that spend a good deal of their time on program-covered services. Quality over quantity is important to keep in mind for every LEA. So now we will cover some requirements to develop and maintain an accurate TSP list. To maintain an accurate TSP list, review and update your LEA's Pool 1 and Pool 2 lists quarterly. Verify that staff included on your TSP list for Pool 1 meet the credential and licensing requirements. Make sure job titles on the TSP list match the approved job classifications that are identified in Section 6 of the ESMA manual and or the LEA BOP provider manual, section titled Rendering Practitioner Qualifications. If they do not match, they can be rejected or dropped from the TSP list unless there is an equivalency form on file. LEAs must complete an equivalency request form for TSPs with different job titles if the LEA wants them to be considered for inclusion on the TSP list. Submit the form to your RMTS unit, who will then submit the form to DHCS for review. It is essential to review the job titles of all staff participating in RMTS. Work closely with your RMTS unit to confirm deadlines for each quarter's TSP list, submit equivalency requests, and make necessary updates before final submission, ensuring compliance and smooth operation. Let's talk about how using vacancies for a quarter can help. Quarter 1 is unique because it begins on July 1st, right when many LEAs are still hiring staff and finalizing extended school year or ESY staff, which can make it challenging to submit an accurate TSP list. And just a quick note, if ESY staff are included on the TSP list, LEAs may claim costs for them. Using the vacancy strategy can help your LEA with building a complete and accurate TSP list. It can help plan ahead for anticipated hires and avoid losing RMTS moments due to unfilled positions. It also can help to protect federal reimbursement opportunities by ensuring that once positions are filled, prorated costs for time worked can be claimed on the LEA BOP cost report and ESMA invoice. Now, let's talk about why to use your vacancy strategy carefully. Regarding using your vacancy strategy wisely, vacant positions will equal lost moments, so you still want to be careful when you are using the vacancy option at your LEA. Vacancies should only be used when the LEA is confident that positions will be filled during the quarter. And without filling vacant roles, it can lead to missed RMTS moments, which impacts federal reimbursement opportunities. Again, LEAs should be confident that the vacant positions will be filled before adding them to their TSP lists. And for example, if there were 20 vacancies planned for the quarter, but only 10 were filled, there may be a greater potential for missed moments. And so before we walk through the individual RMTS moment questions, it's important to understand why moments matter and how ultimately they connect to the reimbursement for LEAs, which is illustrated by the graphic above. The graphic depicts a flow, a survey icon on the left representing the moment response, followed by an arrow to an icon of a person at a laptop representing the activity being coded, another arrow to a calendar icon representing claimable time, and finally an arrow to a dollar sign representing funding. RMTS is not just about documentation. Each moment captures what an individual staff member was doing at an exact moment in time, and those responses are later reviewed and assigned an activity code based on current CMS guidance. These activity codes determine whether the moment is reimbursable or non-reimbursable for ESMA and LEA BOP, and whether it can be included towards the calculation of the RMTS percentage. Moment responses directly influence the claiming ratios used in the ESMA and LEA BOP claiming process. When responses lack sufficient detail, the moment may be coded as non-billable or assigned a less specific code, which can reduce the overall claim amount. Clear, accurate, detailed, and complete responses help ensure moments are coded correctly and consistently. So how does RMTS impact your LEA? RMTS contributes to determining federal reimbursement. RMTS results are used to identify, measure, and allocate the proportion of time that LEA staff spend on allowable Medicaid administrative and direct service activities. These results are then applied to actual salary and benefit costs to calculate the federal share of reimbursement due to the LEAs. The RMTS results, as an RMTS percentage in ESMA or the DMSP and LEA BOP, are one of the key components in the payment methodology for determining federal reimbursement for each program. Participation in RMTS ensures LEA compliance and promotes a valid sample. Each quarter, LEAs must respond to at least 85% of the total sampled moments. This helps ensure that the region can meet CMS compliance requirements. TSPs must respond as soon as possible, but no later than 4 days to the question of what were they doing during that minute. The responses should be in a detailed manner, and incomplete or vague responses may be coded as non-reimbursable, which reduces the LEA's claimable amount, and timely responses help ensure full reimbursement and program integrity. Compliance also ensures funding and audit readiness. RMTS participation is monitored by the regional RMTS unit and DHCS, and LEAs that fail to respond to at least 85% of their sampled moments may have financial consequences. There will be more on 85% details, and we'll be providing that in the following slides. So now let's look at the actual questions in the RMTS. RMTS moment questions are designed to capture what activity occurred at the exact 1 minute moment in time. The time study is not just simply looking for a name of the task, but there also needs to be enough context to understand the entire activity being conducted. That is why there are questions asked, such as, who were you with? What were you doing? And why was the activity being performed? And for Pool 1, there is the pre-question that is incredibly important as it helps with coding and determining if the TSP is doing a billable activity at the time of the moment. The context being captured along with the moment is what allows the moment to be coded correctly. Without sufficient detail, a potentially covered and reimbursable moment will not be claimable. So this example on this slide has an X and a check mark icons next to two different responses that describe essentially the same activity, but with varying levels of detail and resulting in different outcomes. In both cases, the participant is sending an email related to a student. The difference is how clearly the activity is documented in the response. In the first response next to the X regarding emailing staff about a student, the participant could be performing a reimbursable activity, but there isn't enough information to determine because we don't know who the email was sent to, why the email was sent, and whether it supports Medicaid direct or administrative functions. And because assumptions cannot be made, this first moment example would likely be coded as non-reimbursable. And in the second response with the check mark, the same activity is described with sufficient detail. It clearly explains who was involved, what information was being confirmed, and how the activity relates to Medicaid eligibility and the IEP process. This level of detail documented in the moment response would be reviewed and likely coded appropriately to a reimbursable activity code. The key message here is that covered activities still require clear and detailed documentation within the narrative of the moment response. It's not just what you were doing, it's how well you describe the response for what you were doing in that moment of time. And so now that we have covered the RMTS foundations, let's move on to the proposed TSIP. And I'll hand it over to Sherry for the next section.
Thank you, Mohammed. Good afternoon, everyone. My name is Sherry Cranley, and I'm an analyst with the LEA Provider Relations Unit. Now that we have walked through the foundations of RMTS, let's dive into some of the key changes in the proposed TSIP. The HCS anticipates an effective date of July 1st, 2026 to implement RMTS updates through the TSIP. This plan ensures RMTS is clear, consistent, and aligned with CMS's updated expectations. Let's first look at what the TSIP means. The TSIP is a statewide plan that governs how the RMTS is implemented in California. It applies to both direct services and administrative activities and covers time studies conducted under both the LA BOP and the ESMA program. The TSIP is the guidance that explains how RMTS works, who participates, and how time study data is collected and reviewed, amongst other things. The TSIP is intended to support program integrity while providing clear and consistent structure for LEAs participating in RMTS. Proposed TSIP includes several changes that will impact RMTS. For today's training, we'll focus on 3 of the upcoming key changes. We'll begin with an overview of the Q1 time study, then move on to the new calendar requirement. Then we'll wrap up with the response rate compliance and details regarding the 85% compliance requirement. Q1 is the most significant change impacting the RMTS, but other important changes are coming as well, and we'll be here to help. Additional changes included in the TSIP will be covered by DHCS and RMTS units during future trainings this calendar year. And starting off with the implementation of a Q1 time study. 2023 CMS guidance requires RMTS to be conducted for any quarter in which services are being rendered and costs will be claimed. Since most schools are in session for some portion of Q1, a time study is required during this period if Medicaid covered services or allowable activities are being performed and any related costs like salaries and benefits will be claimed. Therefore, DHCS will be implementing a Q1 starting July 1st, 2026. LEAs wanting to claim costs for Q1 must now participate in RMTS, consistent with the process already in place for quarters 2 through 4. We strongly encourage LEAs to start preparing now and work closely with their RMTS units to develop implementation plans. So what this means for your LEA. Missing Q1 RMTS has financial consequences. If a time study isn't conducted for Q1, LEAs won't be able to include costs for that quarter, which will reduce your usual LEA BOP final settlement by approximately 20 to 25%. You will also want to keep your ESMA invoice in mind, since not participating in Q1 will eliminate the ability to submit a Q1 ESMA invoice as well. We're sharing this now to keep you informed and prepared. As we move forward, we strongly encourage you to attend upcoming LEA quarterly meetings and RMTS ESMA quarterly calls for the latest updates as the TSIP takes shape. We will keep program partners updated as much as possible on required changes coming with the 2026-27 fiscal year while we are waiting for CMS's approval of the TSIP. The table on this slide breaks down the differences between the current time study practice on the left side of the table and the proposed practice that will be effective July 1st, 2026, shown on the right. Quarter 1 is defined as July 1st through September 30th, which includes the extended school year, or ESY. Historically, RMTS has only been conducted in 3 of the 4 quarters, starting in quarter 2, meaning quarter 1 was based on the average time study results from quarter 2 through 4. Let's look at how that's changing with the proposed TSIP. Right now, the time study only happens in quarters 2 through 4. Going forward, it will take place in all 4 quarters. LEAs are strongly encouraged to participate in quarter 1 as they will only receive payment for Medicaid covered services when they participate in the time study for that quarter. And here's an important note. Today, LEAs can claim costs for quarter 1 on their CRCS and ESMA invoice without doing a time study. In the future, that won't be allowed. If there is no time study for quarter 1, those costs can't be claimed. And one more change, currently DHCS does not review LEA or TSP calendars or TSP lists for quarter 1. In future practice, quarter 1 LEA and TSP calendars and TSP lists must be submitted for DHCS review. All right, let's go into a little more detail about how quarter 1 will work. On this slide, there's a graphic showing a generalized time frame for developing and submitting quarter 1 TSP lists. This example timeline begins in March or April on the far left and goes through May, June, and finally July 1st on the far right, noting important steps during the timeline months. As noted at the bottom of the slide, this chart outlines typical steps and timeframes, but keep in mind there may be some variations in the timeline and process depending on your region and your system software platform your RMTS unit in your region uses. Each LEA must confirm their region's specific deadlines with their RMTS unit. Okay, so quarter 1 starts July 1. So how do we get there? So in this example, TSP list development, which was discussed earlier, would start as early as March or April. This is considered the open quarter when LEAs can begin updating their TSP lists. Then in May, the LEA would complete and officially submit their TSP list to their RMTS unit. In June, the RMTS units and DHCS review the TSP list. And finally, the time study would start on July 1st. And again, this is a generalized time frame, but we wanted to highlight what the timeline expectations will look like for quarter 1 submissions, so that you can have an idea of what potential operational changes you may have when it comes to seeking reimbursement during this quarter. And in preparation for quarter 1, we'd like to outline some key LEA responsibilities. Identify who should be on your quarter 1 TSP list, keeping in mind the importance of a quality TSP list as discussed earlier in the presentation. When putting together a TSP list, make sure to talk to HR to get an idea of what positions are filled, who is leaving the LEA, number of vacancies needed, etc. Another important department to work with is finance to make sure you are not including TSPs that are ineligible. For example, those that are 100% federally funded or funded through the indirect cost rate funds. Submit TSP lists and calendars to your RMTS unit. We will be going over calendars in the next section. As a reminder, each LEA will need to confirm their region's deadlines for submission with their RMTS unit. Be sure your TSPs have been trained and are prepared to receive and respond to a moment. Consider the following. Do they understand what a quality moment response is? As discussed earlier, TSPs should provide detailed descriptions of what was happening exactly during the time of the moment, including who they were with, what they were doing, and why they were doing the activity. Are they aware of why they are participating and how it is tied to funding? Ensure your TSPs understand the importance of participating in RMTS and the financial impact to the LEA. As mentioned previously, the RMTS results as an RMTS percentage in ESMA and the DMSP in LEA-BOP are one of the key components in the payment methodology for determining federal reimbursement for both programs. Make sure to know who your RMTS unit is, check in with them when any questions or concerns arise, attend their trainings, and comply with all deadlines. Working together will help Q1 implementation successful. Remember, RMTS participation for all quarters is required if an LEA wants to receive reimbursement through their LEA-BOP cost report or ESMA invoice for that quarter. Participation ensures program integrity and maximizes federal funding. In summary, for a successful Q1, here are some key takeaways. Beginning July 1st, 2026, RMTS participation is required for all quarters an LEA wants to receive LEA-BOP or ESMA reimbursement. Failure to participate in Q1 would result in no LEA-BOP or ESMA reimbursement for that quarter, so planning ahead is important. Collaborate closely with your RMTS unit to ensure smooth Q1 implementation. Outline Q1 TSP timelines early and confirm all deadlines with your RMTS unit. Strong coordination with your unit will make this process much smoother. Regularly update and certify your TSP list and coordinate with HR and finance teams to track staffing and funding sources. Finally, training your TSPs is essential so they understand their role, how their participation impacts funding, and are prepared to respond effectively to RMTS moments. On this slide, there are chat bubble icons indicating that we will be pausing for our knowledge check before moving on to the next topic. So we have a knowledge check question on the slide. Starting July 1st, 2026, which of the following statements about claiming Q1 costs on the LEA-BOP cost report and ESMA invoice is correct? A, LEAs can claim Q1 costs as long as they have a contract with their unit. B, LEAs must participate in RMTS for Q1 to include those costs on either the LEA-BOP cost report or ESMA invoice. C, LEAs can use the average RMTS results for Q2 through 4 to claim Q1 costs. Or D, LEAs can include all practitioners on their LEA-BOP cost report and ESMA invoice as long as they provided services during Q1, even if they did not participate in RMTS. So the answer is B. Beginning January 1st, 2026, LEAs must participate in RMTS for Q1 to include those costs on either the LEA-BOP cost report or ESMA invoice. RMTS participation is required for all quarters an LEA wants to receive reimbursement. If an LEA does not participate in RMTS for Q1, they cannot include costs for that quarter on either the LEA-BOP cost report or submit a quarterly ESMA invoice for Q1. Now let's briefly go over why the other options listed were incorrect. Option A, LEAs can claim Q1 costs as long as they have a contract with their unit, is incorrect because having a contract with the RMTS unit does not replace the requirement to participate in RMTS. Option C, LEAs can use the average RMTS results for Q2 through 4 to claim Q1 costs, is incorrect because this reflects current practice, but it will no longer apply under the proposed TSIP. Using averages from other quarters will not be allowed. Q1 costs can only be claimed if RMTS is conducted during Q1. And option D, LEAs can include all practitioners on their LEA-BOP cost report and ESMA invoice as long as they provided services during Q1, even if they did not participate in the RMTS. This is incorrect because RMTS participation is required for all employed practitioners whose costs will be claimed. Right, wonderful, thank you. And I will now pass on to Jorge for our next topic.
Thank you, Sherry. My name is Jorge Alvarez. I'm an analyst with the ESMA program, and we will be going over the new calendar requirement. So before we get into detail of the proposed policy, I want to point out there's going to be some changes compared to the current policy and the new policy. The current policy is located in section 6/12 of the SML manual, which reads, each quarter, district calendars will be reviewed by the LEC/LGA to determine the dates that the students are in attendance, and those dates will be included in the RMTS sample. School calendars will be evaluated annually, and the sample dates will be determined and documented by the LGA/LEC, who is required to notify the SSP vendor of these dates. The proposed policy reads, accurately capture 100% of paid work time for an entire TSP universe. When the LEA has TSPs in both participant pools, a minimum of 2 calendars per LEA are required to differentiate start and end dates per participant pool. When applicable, another categorization may be used to achieve the same purpose. So LEAs will need to submit multiple calendars, which is a minimum of 2, when there are different start and end dates for their participants. The calendars will be submitted by participant pool, or another categorization may be used when appropriate. LEAs must submit a minimum of 2 calendars to reflect earliest and latest work days for the quarter for each pool of participants. 1 calendar can be submitted if all TSPs share the same start and end dates, specifically for quarter 2 and 3. Regardless if the LEA submits 1 or multiple calendars, the LEA must ensure that they have captured 100% of paid and working days for the quarter. Calendars are now based on paid and working days rather than on student attendance days. Currently, developing quarterly calendars involves looking at student attendance days. Under the new CMS guidance, you will need to look at your staff schedules for calendar development. This new requirement will take a bit more effort, so we recommend planning additional time for calendar development. Moving forward, only days when staff are actually paid to work should be included in the calendar. For example, in-service days count and should be included, even if students are not in school, since staff are working and being paid. This will include extended school year, or ESY, as this is part of quarter 4 and or quarter 1, depending on the LEA. On the other hand, days before the school year starts when staff aren't working should not be included. Why does this matter? RMTS enrollment should be based on participants' paid and work time to ensure they reflect actual work activities and not periods when participants are not working. Weekends, holidays, and school breaks where staff are not paid will not be included when generating moments. These days should be excluded from the calendar as well. So on this slide, there's a graphic of 2 August calendars shown side by side to demonstrate submitting multiple calendars. The calendar on the left shows an August calendar with a Pool 2 administrative staff start date on August 1st. The calendar on the right shows an August calendar with a Pool 1 start date on August 15th. In quarter 1, an LEA's administrative staff, or Pool 2, return from the school year on August 1st, while the direct service practitioners, Pool 1, may not return until August 15th. Since there are different start dates for the 2 groups of participants, the LEA should submit 2 LEA calendars, 1 calendar for all Pool 2 staff working on August 1st, and another calendar for Pool 1 staff working on August 15th. Along with 2 calendars, the LEA will provide participant-specific work schedules or shifts to account for the days of week and time that each participant is scheduled to work. If the LEA's standard working hours for full-time employees are 7:45 a.m. to 3:45 p.m., the shift entered for full-time participants should reflect the entire 8 hours period. So now we'll be talking about participant work schedules or shifts. A participant's work shift should cover all hours worked during a workday, which includes lunch and breaks. For full-time participants, they can be grouped into one or more similar shifts that capture total paid and working time for each working day. An example of a shift based on the start and end date a participant is required to be at work is a shift that starts at 7:45 a.m. and ends at 3:45 p.m., which is an 8-hour workday. This shift includes lunch and breaks. For part-time participants, they can be grouped into one or more similar shifts based on their scheduled workdays and hours. For all cases, 100% of participants' shift should be captured. This means recording all time that a TSP is scheduled to work. On this slide, there's a visual which shows examples of 3 different types of shifts. For a full-time participant, a part-time A participant, a part-time B participant. The full-time participant example shows an 8-hour shift from 8 a.m. to 4 p.m. The 2 part-time participants, A and B, show a 4-hour shifts. Participant A shift starts at 8 a.m. and ends at 12 p.m. And for participant B shift, that will start from 12 p.m. to 4 p.m. A participant that is full-time may have a shift that starts from 8 a.m. and ends at 4 p.m. For participants that are part-time, they could have shifts as shown in example participant time A and participant time B. These 2 examples are of participants that have 4-hour workdays. As a quick note regarding moments, it is important to remember that since a moment in the RMTS methodology is defined as a 1 minute in time, no moment shall be issued on the final minute of a TSP's work scheduled because the moment goes past the scheduled time. The new calendar requirements matter if an LEA is participating in both LEA BOP and SMA when 2 calendars are needed to identify Pool 1 and Pool 2 schedules. Having multiple calendars aligns with CMS guidance of capturing all paid and working days. Having multiple calendars helps minimize non-response for participants, which has a direct correlation to the amount of reimbursement for the LEA. So here are some key takeaways. LEAs must submit a minimum of 2 calendars when participants' start and end dates are different by participant pool. Calendars must capture 100% of paid and working time, including in-service days when students are not in attendance. A singular calendar can be submitted when all participants share the same start and end date, specific to quarter 2 and 3, or if an LEA participates in only one school-based program. This slide, chat bubble icon on the left indicates we'll pause for a knowledge check before moving on to our next topic. The question is, under the proposed TSIP, an LEA must submit 1 calendar instead of multiple calendars if the LEA participates in only one school-based program. True or false? So the answer is true. Under the proposed TSIP, an LEA can submit 1 calendar instead of multiple calendars if the LEA participates in one school-based program. The reason for this, if an LEA has participants in one participant pool, they will only need to submit 1 calendar. When LEAs have participants in both participant pools, then a minimum of 2 calendars will need to be submitted. Thank you all. I will hand it over now to Leilani for our next section.
Thank you, Jorge. Hello, my name is Leilani Prez, and I am an analyst with the LEA Provider Relations Unit. I will now be going over the 85% compliance response requirement section. What is the 85% response rate compliance requirement? The 85% response rate is a compliance test that ensures that at least 85% of moments receive a valid response. For example, a response within the required response timeframe is considered valid. An 85% response rate helps ensure that RMTS results accurately reflect the activities of the entire population being surveyed. It is calculated at an aggregate level, not by participant pool. Please note that an LEA's TSPs may impact compliance if they responded on time, late, or not at all to an assigned moment. This 85% threshold applies to the combined quarterly response rate, not to any single staff member or individual moment. Here's an example of two LEAs in which one meets the 85% compliance rate, indicated by the check mark icon, and the other fails to meet the 85% compliance rate, indicated by the X icon. Please note that the calculations in these examples are presented at an oversimplified high level, and that there are more details that go into the 85% response rate calculation, which falls to the RMTS administrative unit for overseeing. In the first example, Rydell High School was assigned 65 moments for a quarter. 85% of the 65 moments is 55, and therefore they need to have at least 55 valid moments responded to by their TSPs. At the end of the quarter, Rydell High School's TSPs responded to a total of 58 of the LEA's assigned moments. Since this is over 55 valid moments, Rydell High School met the 85% response rate compliance requirement. In the second example, Hogwarts Middle School is assigned 72 moments for their TSPs to respond to for the quarter. 85% of 72 moments is 61, and by the end of the quarter, Hogwarts TSPs responded to a total of 39 valid moments. Since only 39 moments were responded to, rather than at least 61 valid moments, Hogwarts Middle School failed to meet the 85% response rate compliance requirement. It is essential for LEAs to encourage their TSPs to respond to moments to meet this compliance requirement. Let's now discuss the penalties for being non-compliant with this requirement. LEAs that fail to meet the 85% response rate are considered non-compliant. If an LEA is non-compliant during a fiscal year, the following three instances will take place. Please note, LEA-specific penalties are generally only applied to LEAs that get a significant number of moments in the quarter. The first instance of non-compliance will result in a warning letter being sent to the LEA, and support will be provided by your RMTS unit in collaboration with DHCS. If the LEA is non-compliant a second quarter, the LEA will be placed on a corrective action plan. And if the LEA is non-compliant for a third quarter, the LEA will not be able to claim or receive federal funding for the participant pools that did not meet the 85% response rate requirement for all non-compliant quarters during the fiscal year. Throughout all three instances, LEAs will receive support from their RMTS unit and DHCS to get back into compliance with RMTS in both programs. It is important for LEAs to ensure their TSPs are responding to their assigned moments, so your LEA can meet the 85% response rate requirement. Key takeaways. First, the goal is for all LEAs to maintain an 85% valid response rate each quarter to meet compliance. Second, as a reminder, unanswered responses count against the 85% compliance rate, so it is important that TSPs respond to their moments timely. Third, LEAs are provided support throughout a fiscal year, during the three-step progressive process mentioned in the previous slide, when non-compliance is present. Finally, if an LEA fails to meet the 85% compliance response rate, funding may be impacted. Please note that each LEA falls within a region and/or regional consortia, which means each LEA contributes to the overall compliance and funding for the region. Always remember, every moment matters, every response counts. The slide chat bubble icons on the left indicate that we'll pause for a knowledge check before moving on to the next topic. Non-response moments do not affect compliance calculations. True or false? Let's go over the answer. False. Non-response moments do affect compliance calculations. Non-response moments are included in the denominator for calculating the 85% moment response rate. It is true that every moment is important, so it is essential for LEAs to make sure their TSPs respond to moments. Every moment counts and every response matters in meeting the 85% response rate compliance requirement. I will now hand it over to Chung.
Thanks, Alani. Let's recap what we covered today. We began with the impact of 2023 CMS guidance on RMTS, RMTS foundations, reviewing what RMTS is and why it matters. Then we move into key changes under the proposed TSIP, including quarter one-time study implementations, new calendars, and the importance of 85% compliance. For the next steps, as an RMTS coordinators, one of your most important relationship is with your RMTS units. There are 11 units regions across California, and each one has its own processes and timelines. If you're unsure who your RMTS unit is, you can use the RMTS unit contact tool available on the DACS RMTS webpage to identify your regional contacts. RMTS units will provide directions on deadlines once DACS get CMS approved. Also, be sure to attend your RMTS unit training and/or ESMA coordinator trainings. These sessions are designed to keep you informed and supported in your roles. On this slide, we included key resources to help your LEA with RMTS and LE BOP requirements. You also find links to the CRCS administrative and audit checklist, CRCS glossary, past trainings, and the LE BOP webpage, and the LEA technical assistance request form. Finally, don't forget to subscribe to LE BOP listserv using the link provided. This ensures you receive updates, reminders, and future training materials. This slides provide additional resources, including those specifically for ESMA program participants. We have also included the link to subscribe to the ESMA listserv, just like the LE BOP listserv we mentioned earlier. Signing up here ensures you receive important updates, training announcements, and reminder directly from DACS. If DACS cannot get to your question today, please email us at rmts@dacs.ca.gov.
We're going to go ahead and open it up for live questions now.
Thank you for unmuting me. And I don't so much have a question as to so much of like a level setting. And there's obviously there's not a lot of clarity on how we're supposed to roll these policies out. So I just want to assure the LEAs on the call, specifically for Region 11, that we are monitoring very closely and we will be there with you every step of the way to roll this out and make sure you can meet DHCS requirements once we know a little more what they look like. And then I wanted to thank DHCS for putting the information out there of what this could look like to get everybody's wheels turning in their head. But it's hard to plan and know how to answer these questions when we're not 100% sure on what's going to be approved. So I just kind of wanted to throw that out there.
Thank you, Jessica. I really appreciate that, especially coming from a LEC. Hopefully that helps to settle some of the nerves. I understand this is such a big change. This is the biggest change to RMTS since LEA BOP joined with the state plan.
I would say it's the biggest change since RMTS changed everything. But we can do it. We can do it.
We can. I appreciate that. And again, we are in constant contact with the LECs, and I know they all do a great job communicating with you, and DHCS will continue to be as transparent as possible. A lot of questions in the chat in regards to calendars and schedules, and I get it. It's a big one, a big change, especially with quarter one. So like we said, and I know it's been mentioned a couple times in the chat, it is a minimum of 2 calendars if you are participating in both cost pools. So both pool 1 and pool 2, LA BOP and ESMA. With that, the way that it's going to work will kind of also depend on how your LEC is rolling that out and the capabilities of the system software platform. So like we said, working with your LEC, make sure you're attending those trainings. If they're sending you an email, you are reading that and coming with questions and whatnot. And again, DHCS is going to always be transparent with not only the LECs, but all program partners so that you are knowing everything as soon as we know it as well. So hopefully that reassures some of you, but I understand huge change. Everybody is uncomfortable with change. So we feel you there and we understand. Big thing is program integrity to make sure that we're in compliance so everybody can continue to draw down those funds that are so important with both programs. Okay, with that, I see some hands. Let's start with Elizabeth.
Okay, so I had seen kind of in the chat and it kind of got briefly mentioned about ESY, that was going to be calendars for ESY because they do work part-time during those days, but we have them on full schedules for other days. So and I thought ESY wasn't even allowed for SMA. So can you provide some clarification on that?
Yeah, sure. So I think historically, the understanding, everything has been related to the regular school year. But if we go based off of the new 2023 school-based services claiming guide, as long as it is a paid working day for the staff member, regardless of if they're doing ESY or some temporary activity during the summer, as long as they're being paid and they're surveyed, you should be able to claim those costs. But then that takes us to what Sarah was just talking about, which is those calendars, right? Because that's where all the questions start coming up about, oh, well, they start this time and they end this time. So again, that's going to depend on the way your SSP functions, which will be a conversation that is had with your LEC. But according to the 2023 guide, as long as you survey and they're being paid, you should be able to claim.
Okay, thank you.
Yes, thank you for that, Jessica. Elizabeth McAnally.
Thank you so much for doing this. I've been a little bit nervous about what to expect for the Q1 TSP list, and especially hearing, the expectations are to have a quality list, and that is our intention 100%, is to be able to come up with a quality TSP list. I've never had this issue before. It takes a lot of work to come up with a quality TSP list for quarters 2, 3, and 4. But for one, I feel like there's going to be so much uncertainty because we don't know. At the end of the year, our staff, I think, has until about June to submit their retirement to notify us whether they're going to be coming back the next school year or not. So I guess I'm hopeful that DHCS or CMS will have grace on LEAs when we can come up with a list per a budget, of what we've anticipated, but I think it might have quite a few names of individuals that will be vacant, or there'll be changes. And I've never submitted a TSP list with so many vacancies. That has me a little bit nervous. And I just want to make sure that it's not going to be held against LEAs, or not that I want to make sure it doesn't, but I'm hoping to do whatever we can so we are not providing a list that's subpar. So that's going to be difficult. And we also have direct service practitioners that work. The calendars is another concern that I think LEAs have, because we have direct service practitioners that work during the summer, obviously, and then and some of them may retire after that. Some of them may not work during the summer and start working, in August. What is that going to look like for our TSP lists and our calendars? Is there a maximum of how many calendars we'd be able to include? And are we going to be assigning the every individual a different calendar, or potentially 5 different calendars, and they'll have to fall under one of those? I just don't know what that's going to look like. I'm just trying to anticipate it because we don't have anything in writing. So the way my mind works is trying to figure it out. How are we going to be compliant? We have had a really, for our RMTS responses, we have a great response rate. And since I'm only an 11-month employee, I've already started the conversations with our administration that I may have to start working on the summer. We may have to do something because we don't want to lose our compliance rate. We're at our district, we're very proud of it, and it's not easy to maintain that compliance rate, and I'd hate to lose it because there's nobody here that's going to be able to help probe, especially for all those code 17s when we have all the staff that may not be there. So just a couple of things. I was hoping that maybe DHCS would consider having these types of conversations with LEAs, possibly our LECs, to walk through what the expectations are so we can ensure we are providing you with a quality TSP list for Q1.
Right. No, definitely. I'm happy to take that feedback back. We have both LABOP on and ESMA teams on here making sure we're noting all of these concerns so that we can continue to update our guidance and communication with you all. I believe you are Region 11, so if that is accurate, you have a fantastic LEC. And I know she will communicate with you as well as communicating with DHCS. Just for transparency, we meet with all of our LECs on a monthly basis, so we are in constant contact with them to make sure that they know what's going on with DHCS, the policy, and once we start having conversations with CMS, we'll be transparent with you all as well, especially with the LECs, because we understand the concerns and the importance of RMTS on both programs. And ultimately, it comes down to the money that you all are able to draw down. So we want to make sure we recognize this first Q1 is going to be a learning experience for us all. So we understand that that's going to be something where you're going to have to adjust and it's going to be rocky, whether it's the LEAs, the LECs, or DHCS. And so with that, and honestly, you mentioned in regards to a quality TSP list, it's really something that if you want to err more on the side of being conservative, that's up to you 100%. Or if you want to utilize vacancies strategically because you think you'll be able to fill some of those positions mid-quarter, then also utilizing that as well. That's kind of why we kind of touched on that. We can definitely dive into that more as we do more trainings in the future and continue that conversation as well. And so that's kind of one of the things we were thinking about with the quality TSP list also. And that's not just for Q1, that's for all quarters. You want to make sure the people that you have on your TSP list are appropriately on there. Because if for some reason they're not doing enough direct service and maybe their moments are then coded to something unbillable, not billable, then you look at possibly driving down your DMSP for the region, not just you specifically, but LEAs as well. So. But yes, thank you for that feedback. We'll definitely incorporate this and continue having these conversations. I appreciate that a lot, Elizabeth.
Thank you.
Of course. Joanna?
First off, thank you so much for all the information. It's really helpful. My question, just quickly, is for the calendars. I saw somebody else put it in the chat as well. But when we submit our calendars, are those, because sometimes we'll have like our draft calendars and they'll be almost finalized, but it won't be finalized by those deadlines, like especially if they're union, they have to be union approved. So I'm just wondering, like if we submit, is that based off of, do they have to be the fully verified calendars, I guess is my question, to meet those deadlines? Are we able to submit after the deadline if we have like alterations to them?
That is a good question. With that, I know that right now the student attendance day calendars go directly to the LECs. Jessica, Rebecca, do you mind jumping in if they're going to be the ability to make any type of changes to a calendar if something changes like that because of union issues?
So what I have to caveat this with, don't hold me to what I say because nothing's finalized, right? But the way I am envisioning it and the way I see it is every classification or certificated has like an agreed upon calendar. So you'd want to use that first start date. Once the sample is pulled, we can't change those dates. So you would only have a chance to change those dates at the beginning of each quarter after that, which might not even matter, you know, since we're really focused on Q1. But no, once the sample is pulled, that's it.
Okay, perfect. Thank you.
At least in my region. Rebecca might want to add on to that. Because I know there's an unplanned feature closure, but I don't think it's intended for that purpose.
Yeah, no, and it just seems like the last year, it seems like the last time we did calendars, it just has stretched on a little bit longer than anticipated. And so that's kind of where that concern comes in.
Yeah, no, I agree. Because even in my county office, we don't know until quite late in the fiscal year. So I really understand. It's kind of like one of those things where it's I guess we're gonna have to do the best that we can. And maybe this needs to be a discussion with administration that we need to get those calendars out sooner rather than later in the future.
Perfect. Okay. Okay, great. Thank you.
Mhm.
This is Rebecca. Can you hear me, Sarah?
Yes, there you are.
So the only thing I want to add is, like Jess said, we still don't know how calendars are truly going to work, but every open quarter you have the ability to make changes from that point forward. So you, like Jess said, you can't go back once we generate moments for that specific quarter, but if something changes moving forward in the next quarter, from when we certify July through September, if something changes from October through June, you have the opportunity to change that at the very least. So again, just wait for your Lex to get in touch with you. We appreciate everything DHCS is giving you guys up front right now, just as a heads up, but we don't have an answer to every question. The chat is just popping off, which is great. We need to know what you guys are concerned about, but please know DHCS and the Lex are doing everything we can together to make this clear, the least amount of confusion possible at all, and you will definitely know what to do from your LEC hopefully sooner rather than later.
Thank you, Rebecca. I really appreciate that. That's super helpful. Selena, I see your hand up.
Yeah, can you hear me?
Yes.
Okay. So I was just looking at, we have we have three. We have a classified calendar, student calendar, and certificated calendar. But looking at our classified calendar, then it's then broken down into 4 subgroups. Would that count as 4 different calendars, or would it just be counted as one calendar?
So, do you mind if I jump in?
Yeah, Jessica, thank you.
Okay, so this is going to be another one of those situations where you have to talk to your LEC because all of this is up in the air. The LECs haven't gotten the green light to change our systems to be able to account for Q1. So there's a lot of, we're not sure yet what that's going to look like and what it can handle. So the DHCS policy as communicated is at least 2 calendars. But some systems might be able to capture more, and those 2 calendars need to be limited or at least specific to cost pool 1 and cost pool 2. So depending on the 4 calendars you're talking about and the sub calendars, are they all in the same pool? Then they could all theoretically have the same start date, and that would be the earliest start date. So again, like the conversations are going to need to continue with your LECs once we're able to see how the SSP functions, and then we can train you guys and give you best practices.
Okay.
And
does that help?
Real quick, a question for Rebecca. If I were to email you this calendar like before our meeting on Tuesday, could that maybe help answer some questions for some people during our meeting?
Sure, send me what you have. And I do, just for Region 10 and anyone who uses PCG as our SSP, we are having a demo of calendar features, and we have districts from the RMTS committee that will be at that training as well. So we do have district input, and I know not every district is the same, but at least having some district input is good because we could see their point of view, because the LECs look at it differently than you guys. But Selena, feel free to send me your calendars. We have a plan in place based on what DHCS has told us so far with the TSIP they're submitting, and we know how we're going to move forward. It's just, this really isn't the platform to be like region specific. This was just more like umbrella. So everybody listening, at some point your LEC will talk to you. If you're crazy worried right now, go to them. We anticipate emails and calls, but we're here to help you guys. And don't think that we're not. We want you guys to be feeling confident and comfortable. And at some point we will. We may not right now today at 2:34 p.m. on the 28th, but believe me, it's going to happen. And Selena, you know, I got you. Send me anything you have.
Okay. Thank you so much, ladies.
Of course. Thank you, Sarah, for letting Jess and I chime in.
Yes,
Oh, yeah, definitely. I always appreciate that. I think, Selena, your hand is still up, but are you good, or did you have more questions?
No, I'm good. Forgot to put my hand down.
Okay, no worries. Elizabeth McAnally.
Just one more question. Sorry, I forgot to ask. Did you give an update? I don't know if I missed it. I apologize about the 1-day notice, 3-day response time, or 2-day notice, 2-day response time. Has anything? Has there been any conversations about that? Any updates that you could be able to you'd be able to share?
I believe Rebecca dropped it in, but we'll go ahead and just say it like we've requested the 3-day response period. So that's pending CMS approval.
That would be ideal. I think as an LEA, I can only tell you our practitioners are already used to the 1-day notice. So the more days that we can have on the back end to get them to respond would be easier for, well, selfishly, it'd be easier for us, but I don't know about other LEAs. I think we're already used to that. So I common sense tells me that sometimes I guess maybe not so common, but we're already used to that.
It is being requested, but again, they could come back and say no. So, but we did request that 3 days.
Do you know when we'll have an update or when we're expected to get response and when that's supposed to start?
We're going to request a feedback timeline or a timeline from them of when we can anticipate some feedback. And as soon as we have that, we will share that.
So don't anticipate something else July 1st, though. You don't anticipate it.
Something else would.
Well, you don't anticipate that coming into effect July 1st?
The 3 days?
It would give us more time. Yes, it would give.
No, I do. So we are submitting it with a 3-day response starting July 1. All of it is proposed for July 1.
Everything's coming July 1.
Yes,
Oh,
all of
such
it.
fun. So much fun.
Thank you for asking.
Right. And then just to reassure everybody on the call, when you, because we are asking for an exception with that 3-day response time, we did a lot of data analysis to make sure that that is something that the state can come in compliance with, because we don't want to put any policy forward that'll negative impact all of you. And so that is something we do have the data to support that 3-day response time. And so that's part of what we're putting in our proposal to CMS so that they can see why this is something that California needs the 3 days instead of something like they want like a 2-day response time. That becomes too tight for us. So just letting you know, we do have the data to support that request.
Thank you, because that would be that would be very difficult for, I think, districts. Speaking for myself, that'd be really difficult. It's not giving us enough time to find out if they're on vacation. You'd have to have an individual specifically dedicated to monitoring where everybody is and why they aren't responding. Thank you. Thank you.
Thank you. I think we are caught up to questions in the chat. Thank you all to both teams who are managing that. That's fantastic. Did we have any other questions at this time? Okay, great.
On behalf of the LEA BOP and ESMA teams, I would like to say thank you all for attending. This concludes our January quarterly meeting, and we appreciate your time and attendance while being here. Your work in the LEA BOP, ESMA, and Medicaid school-based healthcare matters, and we appreciate your ongoing partnership. Your feedback is important and informs how we develop future trainings. Please be sure to take a moment to complete our feedback survey. You can use the QR code on the screen or the link in the chat to submit your thoughts. Trung is going to drop in this link as well as the other links that were talked about during this presentation. And finally, thank you again and have a wonderful rest of your day.